Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant. This week we're going to talk about our title on this week's blog, Reviving Dying Nerves. So this week we're going to talk about nerve degeneration. So for the past several weeks we talked a lot about bone conditions, disc conditions, a lot of different degeneration disorders. This week we're going to talk about nerve degeneration and what we can do to help as far as that. So to begin nerve degeneration, I have three terms on the whiteboard here. I'm not going to write too much on the whiteboard, if any, today. I just wrote those words because a lot of people don't know what they mean. So I'm going to explain them real quick. So we have myelopathy, radiculopathy, and neuropathy. Most people have probably heard mostly of neuropathy because it's very common. Now, one term I want you to see is pathy, and it's on all of them. Pathy basically means disease. Okay, there's a disease there. So we just need to figure out what myelo is, radiculo, and neuro. Okay, so let's go into myelopathy first. Myelopathy is when there is compression on a spinal cord, and that can be directly on the spinal cord. So that can be from bone spurs, from degeneration on bones, that can be from a disc bulge, a disc herniation. Those are the most common reasons there. So yeah, we treat myelopathy patients with our decompression service. Radiculopathy now is when there's compression, more specifically on a nerve root itself. So we have the C5 nerve root, C6 nerve root, L4 nerve root, L5 nerve root, all the way down throughout the entire spine. That is a radiculopathy. The most common cause of a radiculopathy, now it can be caused by bone spurs, disc bulges, disc herniations, but the most common cause of a radiculopathy is what we call a vertebral subluxation. And that's what a chiropractor does, is we fix vertebral subluxation. What a vertebral subluxation is, and here's my spine here, it's when a bone has rotated left, right, up, down, whatever direction. It can tilt to the left, it can tilt to the right. And what it does, these are the nerve roots here, if it turns a certain way, it pinches on that nerve root, causing pain and signals going down the arms, hands, fingers, wherever the nerve root's being affected. So that's radiculopathy. A nerve or neuropathy is when there's direct compression on a specific nerve itself. So carpal tunnel, for example, is compression of the median nerve. You know, a nerve that actually has a specific name, not a disc level, but like the sciatic nerve, the median nerve, the radial nerve, ulnar nerve, wherever the case may be. So that is a neuropathy. Now, what symptoms do these patients have? A lot of these patients have the same type of pain: numbness, tingling, loss of sensation, loss of body function, meaning loss of bowel control, bladder control, breathing difficulty, stomach issues. They all have very similar symptoms. How do you figure out if it's a patient with myelopathy, radiculopathy, or neuropathy? That's a very good question. You have to do an exam. And that's what we do here. We determine myelopathy, radiculopathy, and neuropathy. And sometimes not even our exam is enough to determine that. You know, we take x-rays. Sometimes x-rays aren't enough to confirm that. Whenever we have a patient who needs disc treatment or neuropathy treatment, sometimes we have to send them out for more invasive procedures, MRIs, CTs, a neuroscan, or nerve test, NCVs. Sometimes those things are necessary to determine if it's myelopathy, radiculopathy, or a neuropathy. So how do we treat these patients? These two right here, myelopathy, radiculopathy. In most cases, if they're mild cases, yeah, we can treat them with chiropractic care. But in most of these cases, this one most commonly is chiropractic. This one is mostly chiro, depending on their severity. Now, in more severe cases, it would be with the myelopathy, and they would need decompression that we've talked about several times over the last several weeks in our blogs. Neuropathy now. We have a special device, and it's right here. I'll explain it here in a couple minutes. Neuropathy is a very, very common disorder. Many more people have it than they don't have it at this point. There's 200 different causes of neuropathy in this world. The most common is idiopathic neuropathy, which means there's no known cause. But There's many different causes. Diabetics have a very increased risk of neuropathy. People who have had cancer treatments like chemotherapy, those things can increase your chances of neuropathy. Infection, trauma, those are all really common things. But idiopathic neuropathy is the most common. Now, how do we treat a patient with neuropathy? This device that I have here, right here, it's called HOCAMED. It was made in Germany. There's many, many different protocols, different programs that we use to treat patients with. The science behind it, the therapy is actually called horizontal therapy. What it does is our body contains many different elements that we have essential for the body. Sodium, potassium, chloride, calcium. Whenever these things go in balance, nerves begin to die because those are essential to keep nerves healthy. This device here, what you do is, and I'm actually going to explain like a patient here. They sit down in this chair right here, and we can put 2 patients on at a time. We put them on a program here based off the neuropathy program. There's so many different programs here. We use this for more than just neuropathy, but neuropathy is the most common. We put them on a program. It's a 45-minute treatment, usually about 30 sessions. It depends on the severity of the neuropathy patient. We put them on, and they have pads, okay? Just like a TENS unit, okay? Just like a TENS unit here. The only difference is that we don't want a muscle contraction. What we want is just for you to feel a tingling sensation or a numbness or almost like a pins and needles sensation. If we have a muscle contraction, that's not good. We don't want that. We just want that tingling because it's charging the nerve to revive and wake up. And we've had patients who have come in here on their hands and feet, not being able to feel them and having to be in wheelchairs or walkers, and then putting them on this after 30 sessions. It wakes them up and they are back to where they used to be before they had the neuropathy case. It's the latest state-of-the-art equipment. It works very well. So now, can we put patients with neuropathy on decompression? Yeah, we can. We have. But we see that this works a lot better. And we're the only chiropractors in the area that have something like this. And it works very well. So that's all I have for you guys today. I'm going to talk a lot about this HOCAMED therapy a lot more in the incoming weeks on neuropathy and stuff like that. Neuropathy is a very complex disorder that it can't be just taught in one blog. It has to be taught in several blogs because it's just too much to take in all at once. And this blog might have been a lot for you to take in. So if it was and you have a lot of questions, you know the drill. Give me a call. Shoot me an email. We'll be happy to answer any questions for you. So if you know anyone with neuropathy, mild, moderate, severe, have them give us a call. We'll be happy to answer those questions, get them in, and get them better. That's all I have for you guys today. It's a beautiful week ahead of us. Enjoy this nice weather. People are going to start cutting their grass, putting the flowers in, doing their gardens. So be careful what you're doing. If you have any pain in those situations, give us a call. We'll be happy to help. Have a great day.